One predictable thing about this virus is that it's unpredictable. So I think he's going to be watched very closely. You're going to look for any kind of signs. We all know what they are, fever, cough, and there are some other ones, loss of smell and diarrhea. The most important thing is he having any problem breathing?
CBS's chief medical correspondent, Dr. John LaPook, discussing the next steps for President Trump now that he and the First Lady have tested positive for COVID-19. And the president, being 74 years old, puts him at a high-risk category.
Joining us right now to talk about treatment is Dr. Olayemi Osiyemi. He is an infectious disease specialist at JFK Medical Center. Thank you so much for joining us, doctor. If you were treating the president, what would you be looking at right now?
I think the most important thing right now is checking his oxygenation, making sure it's not short of breath. So there's a little tool you could use to measure that. It's called the pulse ox. You basically put it on his finger and to check how much oxygen is getting in his lungs. As long as that number is at least 94%, then it's in good range. When it gets below 93%, then it's at risk for developing worsening condition.
How is it that people who are of age, 70, the president being a little bit older in this case, and if there's any pre-existing conditions, why is it more dangerous for those types of people?
What we've learned so far is anyone that's older at the age of 50 or 65, but especially 50, are more likely to develop severe infection. Those patient populations tend to also have concomitant medical conditions such as diabetes, hypertension, or heart disease. So those factors put people at risk for severe infection. Younger people with no medical condition tend to do very well. And this is not unique to COVID-19 infection. We also see this with other viruses like influenza, where people are older. Their immune system is not as strong as people are younger, and they have other disease processes that put them at high risk.
Dr. Osiyemi, since the beginning of this pandemic, we've learned more about the virus. Experts like yourself, I'm sure treatment has changed from the start to now. How has treatment changed, and what is going to be implemented to treat the president?
Initially, when we had when COVID-19 started, we didn't really have a formal treatment, so we just kind of used everything that we had. Over time, we realized some of those things we used did not work. So we fine-tuned what we did back then. Now the standard treatment is using antiviral therapy, namely remdesivir, in patients who are admitted to the hospital, people who are not breathing so well, and people who are very sick, we give them plasma. Right now, we don't really have anything approved to be given for patients who have mild disease, who are outpatients. We're doing some studies right now looking at the same drug we use in the hospital with the remdesivir as an outpatient with patients who have mild illness. Even there are monoclonal antibodies that fights against the virus that we're not looking at in the research mode as an outpatient.
Thank you so much, Dr. Osiyemi. We appreciate your expertise.
Sure it will be likely maybe offered remdesivir at this point.
Thank you so much for joining us, sharing your expertise with us this afternoon. We appreciate what you're doing. Thank you so much.